evening. Welcome back to Tuesday Topics. We're glad that you could join us this evening. Each week we take on a new topic. Last week we were blessed with Jamie Dahm, who spoke with us about how we could do digital discipleship in this pandemic. And so tonight we invite you to share that link. You can start a live watch party. Do what you can do to share with your friends so that they don't miss out on the blessings. All right? Pastor Macena?
All right. So once again, welcome to Tuesday Topics. We are glad that, we are here again and sharing different topics every week, that enrich our lives and help us to grow. Today we have Ana Sampaio. Ana is a good friend of ours. So we know each other for, about 13 years. And she is a very committed Christian. And also she's the one that's responsible for my wife being vegan. Yes. Thank you, Anna. My wife is vegan. I don't know if I thank you or not. No, I thank you, Anna. You have been a good support. You are the one that inspired my wife to be a vegan. And I'm not there yet, but hey, I eat home most of the time. So anyway, but Anna, thank you for joining us tonight. But let us know you a little bit. Talk about your family and what you do. I know, you are a registered nurse, and talk a little bit about your life for us.
Okay. So I am a registered nurse. I went to Southern Adventist University. That's where I got my bachelor's degree in nursing. Then I went down to the Amazon River where I worked with tropical disease for a year for ADRA. That's where I learned to speak Portuguese, and I married a Brazilian man, not there, but 5 years later, I met him here, and I still remember to speak Portuguese at the time. So we started to go to the Luso Brazilian church where I actually ended up meeting Pastor Macena a couple of years later. So I have one daughter. I have an 18-year-old. She's currently in college right now. She goes to St. Peter's in Jersey City. They're doing remote learning. So I'm also a holistic health coach. I went to Hawaii to do my coaching there. That's where I learned. And the CEO of my own little company is called Renew Lifestyle Center, where I see patients and I basically, put different health protocols for them, depending on what's going on with them. So, and I'm currently working, of course, as a registered nurse and running my little clinic from my own home.
So Anna, you are a health coach, and you had to, to get your certification in Hawaii. Why Hawaii?
Well, I did it online because for some reason, all of a sudden everything became, the technology, everything was through internet. And it was one of the only, it was called Health Mastery Institute. And it was in I forget which one it is because there's so many little islands. Yeah. And they had one there, and I was surprised. It was the only one that was actually more affordable than the others. Uh-huh. So I went to that one, and I did everything online for in 2.5 years. It was a program that was 4 years, but we were able to do it in 2.5 years. So that's what I did. I think that was in 2013.
That's nice. That's nice. Well, Anna, you are here today to talk to us about how to survive in a pandemic. Yeah. You are in the front line. You have been talking. You talked to my wife, especially for many times, about the situation, the COVID, and glad that you're here and sharing your expertise with us. How can we survive in a pandemic? So the time is yours. Please share your knowledge with us at this moment.
PowerPoint to share with you guys. Okay, everybody can see it okay?
Yes.
So we're gonna be talking obviously about, COVID-19, but that's its real name, SARS-CoV-2. All right, so before we actually get started into the PowerPoint, I wanted to share with you a small quote from my favorite author that writes about health. And it's in the Ministry of Healing, page 128. So it says, too little attention is generally given to the preservation of health. It is far better to prevent disease than to know how to treat it when contracted. It is the duty of every person, for his own sake and for the sake of humanity, to inform himself in regards to the laws of life and conscientiously to obey them. all need to become acquainted with that most wonderful of all organisms, the human body. They should understand the functions of various organs and the dependence of one upon another for healthy action of all. They should study the influence of the mind upon the body and of the body upon the mind and the laws by which they are governed. So, I want to call your attention to the highlighted parts where it says that we should inform ourselves to, in regards to the laws of life, that we should actually become acquainted to understanding how our human body functions, how the various organs depend upon one another, just so that they can work in harmony. This is not just only for nurses and doctors, this is really for everyone. You should be able to study the influence of the mind upon the body and of the body upon the mind. It is good for you to have an understanding of what is going on. And that being said, I want to give you just a simple pathophysiology of what happens with COVID-19. And so pathophysiology mainly means what, the process of that disease, what it does. So what it does, it attacks, can you see the little pointer, right? It attacks the endothelium. So what exactly is the endothelium? You see this little tissue right here? You're gonna find this little tissue that forms around all your blood vessels in the body. And this is a little barrier that protects you from, stuff that's bad, like bacteria, funguses, toxins getting through, and it only allows good stuff to get through. The endothelium is injured in pulmonary circulation by this virus. That's what it does. It comes and it ruins this. The injury results in platelet activation, and I'll explain that, because what the body does is it starts to accumulate platelets in order to wall off the virus. So this process, this platelet activation, can go haywire in some people, especially those that are non-O blood group, they're male, where there's already endothelial dysfunction. So endothelial dysfunction happens with people who have diabetes, obesity, chronic kidney disease, the metabolic syndrome. The metabolic syndrome is those people who have high blood pressure, diabetes, and are obese. Oxidative stress, and oxidative stress is the balance. It's an imbalance between free radicals in your body and the antioxidants that you have. High blood pressure, a body mass index above 30, and just being overweight. So the platelet activation, going back to that, attracts more platelet granules to the site of the injury, especially in the lungs, right? So this is what causes that hypoxia or that low oxygen. It's not a pneumonia. It affects the lungs as a pneumonia, but it's not a pneumonia. The problem is with oxygen diffusion. The oxygen cannot be diffused properly due to clots. That's why there's a drop in the O2 saturation rate. So this has to be treated early to stop this process. Okay, let's see. So the early treatment, what we want to do is give them anticoagulation or antithrombotic. If not, the body ends up in resistance, it won't take. And why don't we see this in children? A lot of people ask themselves, how come we don't see the same process in children? And it's because the platelets are not as hyperactive in kids, and the endothelium does not damage easily, but it can today, given the Western diet, given that now we're seeing a lot of kids more with diabetes, hypertension, high cholesterol. Reminding you again, the oxidative stress is the imbalance between the free radicals and the antioxidants in your body. And oxidative stress leads thrombosis due to the endothelium cell dysfunction. In other words, it no longer works well. It does not protect. And we see that damage in rheumatoid arthritis and high cholesterol and diabetes and obesity and high blood pressure, the metabolic syndrome, the cancer, the cardiovascular disease, or the coronary artery disease. So what COVID-19 does, it tips the balance towards the oxidative stress. And what reduces oxidative stress? A plant-based diet, an increase in your antioxidants. You want to increase those antioxidants. So we can safely say that COVID-19 is a disease of the endothelium, the blood vessels plus clots. And it uses the lungs to get inside the body. And once it's in, it causes damage to the other organs. Now, remember that coronary vascular disease and diabetes and coronary artery disease and obesity are problems with the oxidative stress. So we used to think that it would be problematic for people with lung disease, but we found out that it wasn't, that it affects mainly people with, cardiovascular disease, diabetes, obesity, CAD. And it really, at the end of the day, when everything is said and done and this virus has taken over, it turns the lungs to clear liquid jelly. Thus, this being a very serious disease, it's not just a pneumonia or a cold. So there is something called NAC, or N-acetylcysteine, which is an amino acid and is the precursor to glutathione. So glutathione is an antioxidant that is produced in the liver. So glutathione reduces the oxidative stress by helping the body, by helping the body produce more glutathione. You can get it IV, which is better since if you take it by mouth, it's poorly absorbed. So don't go out there and buy glutathione by mouth because it will not be absorbed well. So they give NAC to assist the production of glutathione. The trick is here in the NAC, in the amino acid, because it's a precursor to making this glutathione. So in terms of the clotting issue, the NAC and the glutathione break something called the disulfide bonds, which help reduce the production of clots. So that's what the NAC does. Now, vitamin D and the protection of the endothelium. These are brand new studies that just recently came out. So we all know that vitamin D is not really a vitamin, but a hormone, and it's lipid soluble. And new study shows that it has antiviral activities against respiratory viruses, tuberculosis, fungal respiratory infections, lymphoma, and sarcoidosis, which are different types of cancer. So what vitamin D does is stabilizes the microvascular endothelium, and it protects against that vascular dysfunction and tissue injury as a result of the local or systemic inflammation that's going on with this. So this is what we actually want for that COVID-19 patient, to have that vitamin D. So the study proposed that the supplementation of vitamin D can actually reduce the risk and the severity of the COVID-19 infection. We want to see it at levels of 40 and 60. When patients come in, they're given 50,000 international units as soon as possible. Patients that have a feeding tube or that are intubated are given the liquid pediatric Bristol that I'm sure most moms probably know. This is what you give your kids when they're little. And we give them like 8,000 international units to treat. And now just remember that most people up here in the Northeast are deficient in vitamin D. So you want to check your levels before you start using any vitamin D. So I wanted to talk to you a little bit about, the long haulers or people with long-term side effects or lingering symptoms. These are people who have now recovered, they've tested negative, and 55% of them still have symptoms. 44% of them have reported a worse quality of life 2 months after the initial infection. So that's very concerning and that's very significant. And these signs and symptoms are fatigue, dyspnea, which is painful breathing, joint pain, chest pain, and cough. It just lingers and lingers. It doesn't go away. So Dr. Daniel Griffin, in his studies here in New York, he shows, he classified them under these 4 areas. He put major signs and symptoms are chest heaviness, fatigue, shortness of breath, depression, and it seems like these symptoms are more predominant in the morning. The chest pain and even the fatigue and the shortness of breath are definitely the result of those little microthrombosis, those little clots. This is where the NAC has been found to assist. He's also seen that biphasic pattern where they're okay and then they start to get worse with the symptoms and they become okay and they worsen, and that's how they just keep going. And then there's pterygium effluvium, which I'm particularly seeing in my nursing home clients right now. I get reports that are losing their hair a lot due to the psychological and physical stress of the disease. That hair loss is temporary, it will return. Also, they're getting a little bit of more behavioral disturbances, memory loss, those sort of things. Now, the symptoms are the results of the clot because they're very little. It's like, again, it's a disease of the microthrombus, right? But the NAC can be helpful. Now, just letting you know that the NAC is not a controlled randomized trial, but it may offer some relief. So if someone was to tell me that they are in this particular situation, they've had COVID and now, they have these symptoms, I would tell them, to try the NAC plus an echocardiogram, because a lot of them show swelling in their lower extremities, the fatigue, the shortness of breath again. That may actually be heart problems. 55% of people that were COVID positive and recovered showed an abnormal echocardiogram. So you see that there was some type of damage to the heart or issues to the heart, myocarditis, which is an inflammation of the muscle, and cardiomyopathy, which is an enlargement of the heart. So to sum that up, the long haulers are very real, and some may not even know, because if they were asymptomatic and they never knew they had this virus, they don't know. They're common. We're going to see more of them. We need more research for this, and they need to consider pulmonary function tests and echocardiograms and NAC. To take NAC at a dose of 600 milligrams twice a day. Again, NAC stands for N-acetylcysteine, which is an amino acid. And reminding you again that COVID-19 is a microthrombus disease. This is not the flu. It's not a common cold. It's not something that you just get over and you'll be okay, even if you were asymptomatic. That's just the truth of it. Now, medical treatments that are currently being used today, to begin with, there are currently no effective treatments for COVID-19. We only have what we call retrospective studies or clinical trials. So one of them is the Plaquenil or the hydroxychloroquine, which is still under clinical trial. It's not even being used anymore as a retrospective study, at least here in New Jersey. I don't know about other states. But it does have, so what Plaquenil or hydroxychloroquine has a zinc ionophore. So the zinc ionophore stops the replication of the virus. Now, please know that it only blocks one side of the disease, reminding you that this is a disease of the microthrombus, right? It damages the endothelium. So it helps in the early course of the disease. It has to be given early. It doesn't help if you're in ICU already dealing with inflammation and the whole cytokine storm. It works better in combination with zinc, the Z-Pak. So it would be Plaquenil or hydroxychloroquine, azithromycin, which is another name for Z-Pak, and zinc sulfate. I'm sure that most of you at one point or another in your life had Z-Pak. Z-Pak fights those upper respiratory infections. You take this one little pink pill once a day for 5 days. But what Z-Pak does is, it's not fighting some type of viral infections, because it's more used for bacterial infection. But it decreases inflammation, and that's why it's given. And it can also help out if a secondary infection comes, because that can happen. So Plaquenil was being given at 400 milligrams daily, then 200 milligrams twice a day for 5 days. It's a very short dose. The course was very short. The Z-Pak was its regular dosage, 500 milligrams daily for 5 days, and zinc sulfate, 200 in its form sulfate, 220 milligrams twice a day. Now, Plaquenil or the hydroxychloroquine has been successful and proven to treat malaria. It also has been used in SARS and MERS, and HIV, and dengue, and influenza A, and Ebola, and hepatitis C, and some other autoimmune conditions. Now, ivermectin. Ivermectin is being used as an emergency use authorization for adults and kids with severe COVID disease. It's still a retrospective study, but it prevents the virus from making the cells sticky. And it also has an antiviral activity, but it's still under research. So we're still using the remdesivir, and that is available IV only. It stops the spreading of the virus in the body, and it has a zinc ionophore too. So it has been shown to reduce hospitalization stay from 15 days to 11 days. And this considered so far a safe drug, although you do have to do liver enzyme, also kidney function tests. Convalescent plasma is basically just that. It's plasma for someone who was sick, and there's antibodies because they have survived the disease, and it's relatively safe. You just have to make sure you do a cross match to see if you're like with A, B, or O. Vitamin C IV, it improves the person's immunity to fight back. Dexamethasone or Decadron is a corticosteroid that helps decrease the inflammation by suppressing the immune system. Aspirin, heparin, Lovenox, these are blood thinners that help with the clotting, and piperidamole, which I particularly like because it inhibits the platelet activation, the adhesions, and the aggregations, reminding you again that the platelets are very hyperactive in COVID-19. You clot. Interferon beta, it's a shot that's given to increase the immunity to help fight the infection. So in other countries, like in India or other third world countries, they use what is called the MATH protocol. So the M stands for methylprednisolone, which is a type of steroid, the ascorbic acid, which is the vitamin C, the thiamine, which is part of the B complex, which also improves immunity, the heparin, which is the blood thinners, the zinc, which has that, it reduces the replication of the virus, the melatonin fights back the cytokine storm. And we'll talk a little bit about melatonin in a minute, and vitamin D. And this is what they use in other countries, and it seems to be working okay for them. So low-risk treatments, that you can pretty much do some of these at home. So vitamin C, you can take up to 3,000 milligrams a day, and that improves your immunity. You can take some melatonin. It inhibits COVID-19 cytokine storm. That is that inflammatory process responsible for lung injury, for fever, for cough, for shortness of breath, that lung fibrosis, those long-term complications, and eventually death. That's what leads them to death. Bromelain, it's an enzyme that is found in pineapples or pineapple juice. It slows blood clotting. And what I like about bromelain is that it has antithrombotic properties where it reduces the formation of the blood clots. It's fibrinolytic, which causes those thrombuses to break if they're already formed. And it's antiplatelets. It stops the platelets from sticking together. I mean, this is really, really good. Zinc sulfate, if you're gonna get it in its sulfate form, is 220 milligrams twice a day. Now, if you're gonna get zinc on its own or either zinc citrate, you can get 30 to 40 milligrams. If you're a healthcare professional, you can take up to 50 milligrams daily. Artemisia annua, it's a herbal remedy and it's used to treat malaria for people who don't take hydroxychloroquine or can't take hydroxychloroquine. So they take Artemisia annua, and it's used to treat malaria. It's antiviral, also assists with menstrual cramps, it's anti-fever. 400 milligrams 3 times a day for prevention, and 9 capsules daily for an active infection for 1 full week. An infrared sauna. If you have an infrared sauna at home, because I know most gyms are still closed, gyms started to open here with 25% capacity, but the saunas aren't open. So, but if you have one at home, an infrared sauna, or if you can turn your bathroom into a sauna, the steam or dry sauna, it definitely improves immunity because it helps you to sweat out toxins and cleans your lymphatic system. Hydrotherapy, that contrast shower, you want to do 14 minutes, and this really shoots up the immune system. So you want to do 5 minutes hot, 1 minute cold, 5 minutes hot, 3 minutes hot, 1 minute cold, 3 minutes hot, 1 minute cold. That gives you 14 minutes. And that will definitely bring that immune system up to work. Now, if you have arrhythmias, it might set them off from the adrenaline caused by the cold shower. Hygiene. Just hand washing with soap and water for 20 seconds, using hand sanitizer that has 60% ethyl alcohol. You want to make sure you avoid those brands that the FDA declare them to have methanol, which was poisoning people. Avoid touching your face at all times, especially after wearing a mask. Now, because of that constant hand washing or that constant disinfecting, sanitizing, sometimes you can dry out your hands, you can kill off some of the good bacteria that you also have in your hands. So you want to use something called Dr. Ohira soap, which has that nice bacteria probiotics for your skin. You can get some of that soap. Now, masks. Lots of people ask, do they really work? Yes, they do. You want to use your mask. So The the New England Journal of Medicine, they used laser light scattering where you can visualize speech particles when you talk, and you can see what happens if somebody's wearing a mask and someone's not wearing a mask. And I'll show you like a very small video that is a couple of, I think it's 35 seconds long. So just listen and look.
Now, I wanted to show you some interesting research that was published in the New England Journal of Medicine, visualizing speech-generated oral fluid droplets with laser light scattering. And I want to show you what the difference is between wearing a mask and not wearing a mask in terms of the droplets that you see with laser light scattering. Let's take a look at the video. So here it is without a mask. Now I'm recording. Stay healthy.
Do you see the little green stuff? That's
Stay healthy.
Particles. That's without a mask.
That's loud. Stay healthy. Good.
Now with a mask.
Are you recording? Yeah. Stay healthy. Louder. Stay healthy. Louder. Stay healthy. Nothing. So you can see perhaps why the CDC is recommending when you're in the store, going out in the public, you may want to continue to wear a face mask.
Okay, let's see. I'm trying to move.
I wanted to show you some interesting.
I'm trying to move that PowerPoint. Let's see if it works. Okay, so the prolonged use of a medical mask can be uncomfortable. However, it does not lead to CO2 intoxication or oxygen deficiency. Now, while wearing a medical mask, make sure that it does fit properly and that it's tight enough to allow you to breathe normally. Do not reuse a disposable mask and always change it as soon as it gets damp. The prolonged use of medical masks properly used does not cause CO2 intoxication or oxygen deficiency. In the CDC website, if you read through it, you will find that if you are exercising, they recommend not to wear a mask because it gets really sweaty and wet, and you can actually have breakouts around your face. That's why. Now, if there's a lot of people and that's what your town or your city recommends, or the gym where you're going to, I just don't see how mask wearing in gyms is possible. It's really hard, I think, but if that's what they're recommending, then that's probably what you have to do. Now, what I'm doing for me, for my family, and for my patients, and what I recommend is vitamin C. Take a supplement. Not just a supplement, but do a bowl of fruit, a green juice, 500 milligrams twice a day. If you can get it IV, that's great. I did mine IV this past Sunday. I have a place here in Clifton where they do vitamin C IV infusions. Vitamin D, just reminding you that it prevents respiratory tract infections. Take it daily, 2,500 international units. Please do like a blood test. To make sure whether you're deficient or you may not be deficient. Try to be outdoors during the summertime. Summer's almost over, but even with the fall being here, you can still get some of those rays in. If you can, try to wear a DVD. If you're walking outside, try to expose as much as your body to it. Now, of course, if you have a backyard and you can lay by your pool, or you can just sunbathe in the backyard with your bathing suit, that's great. 40% of your body should be exposed to absorb the vitamin D. Quercetin is an excellent antioxidant, and it has a zinc ionoform that shuts the replication of the virus. You want to take 500 milligrams of that twice a day. Now, more studies are being done in Canada right now to use with their COVID-19 patients. The NAC, or the N-acetylcysteine, the amino acid, you want to take 600 milligrams twice a day for 6 months, especially if you've already had the COVID, okay? But you can take it if you haven't had it either, because remember, this is a precursor to making glutathione for your liver. So it also shortens the influenza virus. It helps the liver get rid of the toxins, and it breaks down those disulfide bonds to prevent the blood clotting. The zinc, if you're going to take zinc alone, you want 30 to 50 milligrams daily. You want to sleep 7 to 8 hours at night. Sleep assists your immunity and it helps you not to get sick. And you certainly want to do also like a plant-based diet. Most of you at Ellicott City did the 2030 program. That's a good program to start. If you don't have that program, you can access that program at renewlifestylecenter.com. Also on this website, if you go under the blog, you're going to see the recommendations that I gave here. They're all written out there for you nicely. Also, there's a link to where you can buy them at an affordable price and of good quality. You want a product that is of good quality. So you can go on the blog under renewlifestylecenter.com and access those low risk treatments or modalities that you can use at home right now. Let's talk a little bit about the vaccine. It's an RNA vaccine. Obviously, it's a vaccine for COVID-19. So we have Moderna, Oxford, and Pfizer ahead doing all these things. And what basically, and just so you let you know, I do not have any stocks or bonds with any of these companies. I'm not, promoting them or anything like that. But Moderna, what their vaccine is actually doing is helping to produce antibodies, and it causes you to produce the protein that produces the antibody. So what they need to do still is to find the right dose, not too much, not too little. The name of that vaccine is mRNA 1273. Two injections are necessary for it. Questions they're still being asked is how long will the antibodies respond last? The true level of safety is still unknown. And we don't know if it will prevent you from getting the virus. Just somewhat like the flu shot. Sometimes you take the flu shot, you still get the flu. You want to consider the side effects. And the vaccine right now is currently on third phase trials. All of them are. I know here in Newark, New Jersey, the mayor just announced that if you wanted to be part of those trials, you can go to Rutgers University. They're the ones that are doing it. You don't have to if you don't want to, but you can participate. And you can always go on moderna.org or moderna.com, look them up and see, consider the side effects, look through everything, and then make a decision if that's what you want. What I wanted to talk to you a little bit about is that at-home rapid result testing. I'm not sure if you guys have heard of this yet or not as of yet. So the at-home rapid result test, it was something that Dr. Michael Mina, he's a virologist and an immunologist from Harvard. This is a cheaper solution. They're this little paper test that use your saliva. They're less risky. It's a public health tool. It reduces the transmission of infections at a public health level. So it's a public health intervention. It's less sensitive than the PCR, and it tests the viral load. It tests at 100,000 for a viral load. The PCR, which we currently have right now, it tests at 10,000, so it's a lot more sensitive, right? But testing at 100,000 will let you know if you're transmitting this virus, and it finds those at greater risk for transmitting the virus. The FDA right now seems not to have actually the will to do this. It actually has become a barrier. This is public knowledge. We're not talking bad about them or anything like that. They've become a barrier to doing these tests. They refuse to regulate because they see them more as a public health tool versus a diagnostic test. The FDA regulates diagnostics and medications versus, public health tools. So they're not really, they just don't have the will right now to do this. But as per Dr. Mina, this is a cheaper solution. It's less risky as a public health tool to reduce the infection at a public health level. We need more public health interventions to diminish epidemics versus expensive diagnostic tests. Now they have to be worked out politically because it's a cheap antigen test. It costs $1. And it can be done at home, and it can help you figure out if you're infectious. So the most important thing here is for you to reach out to your officials to make it happen. And I'll talk to you a little bit more about that. All right, so let's make a comparison. So here we have Dr. Mina's paper antigen test, and here we have the actual PCR test, right? So the paper antigen is $1 to $2. That's what it costs. If it gets approved and everything, you can just basically get it from Walmart, Rite Aid. You can get 30 tests for $30. You can test on the daily. The PCR is about $35 to $200. You get a rapid result, 15 minutes, 10 to 15 minutes at most. Results with the PCR, they're 1 to 7 days or more, depending where you are. Also, if you're at the hospital, you can get it on the same day. This is done at home. It's a simple saliva test. This one is not self-administered. You have to have a professional do it for you. You know, they stick that swab down your nose to your throat. It could be used daily or nearly daily. To do a PCR test is not realistic, so it's not used frequently. Most nursing homes or hospitals use it every week or every 2 weeks. It could be quickly mass produced. The PCR, there's limitations to mass production. And it also includes a lab processing. So that's a little bit of a it just holds them back a bit. This is sensitive enough to detect the vast majority of infections of COVID-19, and this is highly sensitive. Both tests are good, but in order to reduce this whole pandemic, the paper antigens would be really good and would be best. And let me explain it to you. All right. So here's a high viral load and here's a low viral load, right? And here's the time. And this is your infection. Here are your viruses. So you get sick right now, right here. 40% of the population is asymptomatic, all right? So you start to go here, and for whatever reason, you find out, oh my goodness, I was with a person, they got COVID, maybe I should get tested. So you go and get a PCR test. The green is the PCR, the paper test is the blue one. So right here at 10,000, at that CT value of 10,000, you're gonna show up positive. You still have no symptoms. You may not have any symptoms. All right, so you quarantine, you stay home, whatever. But here you are and you decide to do a paper antigen test and you wait a little longer. And right here, you're going to be at 100,000. This is where you're actually transmitting the virus. You're unlikely transmitting the virus here. You're probably not transmitting the virus at 10,000. So you're transmitting the virus at 100,000 on viral load. And if you continue to test and you continue to test at home daily, you'll see how long you'll stay positive until finally your infection rate comes back and you're no longer positive, you're no longer transmitting. Fine, you go on, you're negative, you've quarantined, you've stayed home, you've decided not to go to school, not to open your business, not to go out. All right, so with the PCR test, it's so sensitive. Let's say you were asymptomatic, you went through this whole thing, but somehow you were with somebody, then all of a sudden you found out, oh my gosh, there were people, let me go to get tested. But you're here, you're gonna be testing positive and they're gonna tell you you need to go in quarantine. You probably don't need to quarantine anymore because you've gone through your viral transmission phase. You don't need it no more. And then you're gonna test positive for the next 2 months, if not the whole month, because the PCR will still test for residual and RNA material from that virus, still 1 month, even up to 2 months. I have clients that test up to 2 months and they've passed their viral transmission phase already. With the cheap antigen test, you have a little bit more control. It really is a public health tool. You decide to stay home, you stay home. Or if you're symptomatic and you need to go to the hospital and you're unwell, you want to do that. So both tests are good, but if we want to get rid of this pandemic and be done and away with, we want this paper antigen test with us, we really do. And in order to make that happen, you want to send a letter to your senator and your governor by visiting rapidtest.org. Or you can text Rapid Congress to 5049, and that will send a letter to your senator. Or you can text RapidGov to 5049 to send a letter to your governor. Or you can just go to rapidtest.org, look it up, look at what Dr. Mina says. Dr. Mina is working with a lot of the public school systems in New York City. He's working all over. Actually, the state of Michigan is looking to do this. They are very excited about it and they want this. Again, it is the FDA that has become somewhat of a barrier for this. So you want to do that. The more support we get, the better it is for the nation. Really, that's what it comes down to. Let's see. before I show you that slide, so we're pretty much basically it's over, but I just wanted to give you my disclaimer. Any statements expressed in this program today was just for informational purposes and self-help. They're not intended to be a substitute for professional medical prevention, diagnosis, or treatment. Please consult with your healthcare provider before making any changes, as only your healthcare provider can provide you with advice on what is safe and effective for your unique needs or diagnose your particular medical history. Be sure to check with your healthcare provider regarding taking any supplements or herbs. Pregnant and breastfeeding women should never take anything without consulting a physician. If you currently take any prescription medications, be sure your prescribing physician approves any eating plan you undergo, as some foods such as grapefruits, grapefruit juice, or even pineapple juice can interfere with the effectiveness of medication. Sometimes the grapefruits interfere with high blood pressure meds, and the pineapple juice, if you're on a blood thinner or a Coumadin, you certainly don't want to take that. That's what I wanted to tell you. And, last but not least, to close off, COVID-19 is like that thief that comes to steal, kill, and destroy. But know that you have a Savior, Jesus Christ, who has come that you may have life and that you may have it more abundantly. And in nature, we have, in science itself, our Heavenly Father offers you life. He offers you modalities and He protects you. He doesn't want you to be part of that thief that comes to steal, kill, and destroy. He wants you to have health in mind, body, and spirit. So, work it out. Work everything that you have heard here today. Work it out in fear and trembling before the Lord through the study of His word, through the study of the spirit of prophecy. Put it in the altar of the Lord and let the Lord give you life more abundantly for mind, body, and soul. So this is the end of our presentation. If there are any questions, I am open to answering. I can't hear you, but I think you're muted.
Yeah. Yes, I was.
That's okay.
Thank you, Anna, for sharing with us your knowledge. There are a few questions here. Let me start with the first one. It says, someone is asking, what about flu shot? How can that help? Do you recommend taking the flu shot? I have never taken it before. So what's your take about the flu shot?
There were some retrospective studies, and this, again, they're retrospective studies. They're not, clinical trials. The FDA, the CDC does not say anything like that. If you've never taken a flu shot and you've done okay so far, then I would continue. Now, I have not taken a flu shot. I use a mask when needed. And if you take the supplementations I've given you, you may not need one. Now, if you are an elderly person and you're immunocompromised, you might have to take that flu shot. Again, that is something, like I've always tell people, you have to work that out for yourself in fear and trembling before the Lord through study of His word. Research for yourself, look at things, make comparisons. If you go on Renew Lifestyle Center, the Facebook page, I did post that retrospective study on flu shots and COVID-19. So you might want to read through that, and then that should help you make a decision as to whether you want to take that or not. I'll speak for myself. I've never taken a flu shot. I've never had the flu either. And if you do have the flu, don't think that the flu is this horrible thing, it could be for people who are very immune compromised. But it could actually manifest itself like a cold, and you'll be okay. I mean, unfortunately, during this time, we all gonna end up, if you get sick, because COVID-19 has more or less, actually yesterday, so I was listening to one of the doctors speak, and so fever comes first with COVID-19. And if it's the flu, you're going to see cough and then fever. So if your cough starts first, it's probably the flu and then the fever. And if your fever comes first, then the cough. But you know what? Sometimes those things work, sometimes they're not. But, work it out for yourself. I've never taken the flu shot.
Okay, thank you for clarifying that. So we have another question. Well, more of a comment, and then you can respond to the comment. I was told it's not a good idea to take the test. It's used as a market, and that eventually will be needed to show for travel, shopping, etc. Sorry, it's used as a marker, not market. So any observation on that, on taking the COVID test that is available to be used?
You know, if needed and you need to take it, it's a good tool. You know, it's not a bad thing. It'll let you know. I'm not sure what they're trying to say in terms of is it contact tracing that they're worried about? Is that what the person was saying, Debbie?
It's not clarified. I'm not sure if they would like to clarify it themselves.
I mean, if you're worried, a lot of people are very worried about contact tracing. I mean, there's apps on your phone now, the new updates and things like that. But contact tracing has been done for years. I mean, don't think that people are sometimes what people think is people are going to have access to your social security number, your life, what's going on, what is happening. They're going to come after you. It doesn't really work like that, because truthfully and honestly, if you own a credit card, they have all that information already.
Yeah.
You know, if contact tracing really is just to help prevent and to control the virus. Again, you don't have to do it if you don't really want to, if you feel like I don't want to do this, but God forbid that you do need to take the test and you want to know if you have influenza A or B, or if you had COVID, please do take it. You know, you want to know what it is so that it could be treated appropriately. But do not worry, you know, don't make the whole contact tracing to be somewhat of a conspiracy theory. It's really not. Contact tracing's been around for years, even in other countries. I mean, with the SARS and the MERS happened, contact tracing was done in the Middle East. China has been doing contact tracing for years too, for different things. Yeah, don't get scared about that.
Yeah.
Good to know.
So Anna, you mentioned in the beginning about prevention, right? So you read a quote about prevention. Could you expand that idea a little bit more? What else can we do? You know, so how can we, I mean, if we get COVID, and, you know, God willing we don't, but if you do, what would be good if I already been doing? What would be my steps, you know, to get ready if I get this thing? So how should I live my life today?
You should live your life by taking those supplements I told you. That's exactly what I do. I take my vitamin C, I take my NAC, my quercetin, my zinc, and I eat a vegan diet. You know, avoid sugar, please, at all costs. Sugar will kill your immunity in a minute, you know. Avoid the sugar at all costs. And truthfully, do try to exercise. You know, the winter's coming. We'll be indoors. Our vitamin D levels will drop. I'll be honest with you, my vitamin D levels they've been low at 25. And like I told you, in order to, you know, fight off COVID, you need it to be between 40 and 60. That's what I had mentioned. Mine sometimes has been at 28, at 25, and that's bad. So this particular summertime, I've been out every day. I wear a DVD and shorts, and I'll stay outside just walking in circles in the park for a full hour, just exposing my body. And truthfully, just saying a prayer, because some people just absorb it. Well, I'm one of those people, I don't absorb not much of that. I don't know if it's getting pulled from somewhere to heal something in me. I don't know, but I have to supplement and be outside. So, you know, test those levels. And I say a prayer. I say, Lord, Heavenly Father, please let those rays of that sun be absorbed into my body. And, you know, put it in mind that, you know, it is God who heals. It is God who makes it work for you. But yeah, do those things. And if you go to renewlifestylecenter.com, they're right there on the blog, and you can click. It's free. It's available. You don't have to pay to be part of the blog or part of the website. You can print out all that stuff that's there. You can purchase the products, not on my website, but it takes you to like Amazon or different companies that, you know, they're affordable and they're of good quality. I don't want to give you some, I don't want you to run to the store, to Costco or to Rite Aid or to CVS and just grab something off the shelf. I just don't believe in you. I don't believe in that because a lot of stuff has lots of fillers and other ingredients that there's more of other ingredients in the actual NAC or than the actual vitamin D or than the actual vitamin C.
So that was going to be my next question was, I see this list, what am I doing for my family, and your suggestions with the vitamin C, the D, et cetera. And I was wondering, where can we get them? Because what if we're talking about a larger family or a limited income or both at the same time? How affordable is this? Is there a better place or a worse place for getting these vitamin C's? Although you've partially answered it.
Yeah, I am going to put I believe it's, let me just look it up right here really quick right now. I am going to put up on that site, there is something cheaper than what I have than what I have put there, but the NAC is $18 and there's 500 pills for $18, so it's super cheap.
Wow.
And you want to get NAC from now. There is, okay, it's from Puritan. Let's see. Want to give, and I will put that up on the website. This is something that there was a client, Puritan's Pride. So you want to go into puritanspride.com and you can get, like, she was able to get 3 bottles of quercetin and vitamin C together in one bottle for $33. So you now have quercetin and vitamin C together, 300 pills for each bottle. So there goes for a large family. If you have a large family, there are 300 pills that come. I'm just reading this from my client. 300 pills, she was able to find it. And I had checked it out. And it was $33 for 3 bottles. And it both had quercetin and vitamin C, and they had very high amounts. So, and it's called Puritan's Pride, but I'll go to the blog and I'll put it in there at the bottom so people can have updated information with that. And especially that's for large families or for people who are on an income. And I had forgotten about that, but the Puritan's Pride is very, very affordable. I looked through their stuff and it's very good stuff.
Anna, what was the blog again so that we can put it into the chat?
It's renewlifestylecenter.com.
New Lifestyle Center. Okay.
And just go under the blog. You can, it'll be a website, but go on the top where it says blog and it'll take you.
Okay.
So Anna, you, in this COVID now, we had a worse, and now seems like it's getting a little bit better, less people get infected. You have been working on the front line as a nurse. Do we have less case today than we had like a month or 2 months ago?
Yes, we do. We have a lot more less cases today. I'll tell you what New Jersey's cases were. Give me one quick minute. So we only had 11 deaths and we have 329 new cases and 11 deaths. So that's for the whole state. So we're not seeing as much anymore. And I was reading yesterday where it seems like the virus is losing its strength somewhat to a degree. And, viruses do this throughout history. We've seen that happen, and we pray to God Almighty that that comes to be true, where, they go through their phase where this is where it peaks, and then it starts to go, and then it can peak really high, and then finally drop and somewhat disappear. You'll see cases, isolated cases here and there, but nothing like we're seeing now. So, viruses tend to do that unless, for whatever reason, the Lord does not allow it to disappear and we have to live with this. It would be completely disastrous, in my opinion, because of the long-term side effects. We'll see a very sick society dependent on so many drugs, and especially for our elderly population. Those who, what I've seen with my elderly population is those that were not bedbound and they were able to still get around. They are now in wheelchairs. They've lost their hair. There's more behavioral disturbances, lots more memory loss than what they already have. And they're bound to a bed. And they were not like this in March. They were not like this. And same thing goes for some of my coworkers. I have a friend of mine who works at an LTAC, which is a specialized facility that only deals with ventilators. And he ended up with COVID, and he's 35. And, he still has the shortness of breath. He still has the chest heaviness. So he still has those little microthrombus around. And so he just got on MAC. I still have to ask him how he's doing. And we have a lot of the nurses who complain that walking from the parking lot to the hospital or to the nursing home, it's a struggle. And they don't understand, like, why am I feeling like this? And these are those long-term side effects. And this is the sad part.
Well,
One, one of the things. Sorry. One of the things that you mentioned is or of course, our trust in God. Trust in the Lord. That Lord is in control of our lives, and sometimes God allows things to come, and for sure, every circumstances help us to look into ourselves, look into our lives, and think about the way we are living, the things that are valuing our lives, and how can we, live a life that's more abundantly. That's the word you used before, live a life more abundantly, So I thank you for that touch, that's important, that we always remember that God is there in this journey with us.
Yeah, what it helps me, I'll be honest with you, the first 40 days, I cried every single day for 45 days. I just felt so unstable. And what really helped me was, the Psalms. And I don't know if you guys have that. I mean, this is really old. I remember this as a child. I still have that, the Daily Bread Promise box. Debbie, I don't know if you remember that. Because I learned of that here, when I became a Seventh-day Adventist. I'm not sure, Pastor Masen, if they have this in Brazil. It's like a little loaf of bread.
I'm not that old.
No.
I'm not that old. I just dizzy.
It's a little bread box, and inside there's a bunch of promises. And I used to just I used to go and pray. I used to pray, just get on my knees, and I would plead with the Lord, and I would pull my promises. And God was so good to me. He told me, "You will walk amongst the living." And let me tell you, that has stuck to me like white on rice. It really has. You will walk, and I have walked amongst the living. I have not gotten sick. God be praised. To Him be all the glory. Commit your life to God is the best thing you can do, because you really can become unstable from listening everything that goes on in the news. There's a lot of fear that I feel like it's just instilled into the news, the media, the newspaper, the reading materials, Facebook, everything. And you want to commit your life to the Lord. We're living difficult times, and I don't really think that it's going to get any better, in terms of just what's happening in America and all. And you definitely want to make sure that you're right with God. Make sure you put your life right with God, your convictions, make them a priority, that what you believe in, and ask the Lord for repentance, for renewal, for restoration, become involved in whatever Ellicott City offers. Sometimes the Lord has special messages through all the different programs that is given. I remember the few programs that Pastor Macena did initially. They helped me a lot, and sometimes I would go and look somewhere else, but God, become involved with your church. I'm not sure if you're holding services. Are you holding services yet or not yet? You're still doing everything through Zoom?
Yeah, we are doing live, not live, and we are doing movies night, and we did a few driving church as well. We are trying to, because we think it's important fellowship as well as everybody else, trying to make some connections as much as we can.
Yeah, because that is going to help your mental health. A lot of people are very unwell, and I'll tell you that from just friends and family, because they lack Jesus, because they lack a community. People become unwell. They will bury themselves in their depression. I mean, just 2 weeks ago, one of my family members committed suicide. He shot himself in the head. He was COVID-19 positive. And this just didn't, and he was 31 years old.
Wow.
So, and this is where, the lack of Jesus in people's heart, Jesus is not present. So you go out there and plant seeds, concentrate on spreading the gospel, on living for the Lord, trusting in God, getting involved in your community, being part of your church through Zoom, through the movies, through whatever you're doing, do not let depression, bring you down. Do not.
Well, Anna, thank you so much. This has been a wonderful blessing, such a wealth of information. We appreciate your time and we appreciate your knowledge and
Absolutely.
you willing to share it with us. We just pray that we are all protected and have the tools and the information we need to fight the virus if it does come our way. But again, Anna, thank you so much for being with us. We thank all of our viewers for being with us. We pray that God is blessing you in your homes. And we'll see you again next week for Tuesday Topics. Good night, everyone.
Good night.
Right, good night.